Yes, what are your question numbers?
12.
Question number 12. Is how many horizontal muscles? What is your answer here? Question number 12. What is your answer?
B. Option B.
67312. Everyone? Everyone 67312. Okay. Next question number. Any doubt in that question? Next question number.
20, sir.
20. Recession strabismus procedure of the lateral rectus muscle. Yes. What's your answer?
D for Delhi, sir.
D for Delhi. Everyone? Any other answers? Any other answers? Question number 20. Any answers? Anyone need to explain this question? Question number 20. Next question number.
29.
29. Yes.
21, sir.
21. Yes. What is your answer?
Double 6 9 8.
984. Right? 984 or 982?
984.
984.
984, sir.
A is the answer.
D answer.
A, right?
Yes, sir.
Yes, sir.
Next question number.
Now, lens also is facing, no, sir?
Which one? Actually,
21.
placing the lens. A patient is diagnosed with, she is taken to the operating room and a phacoemulsification with intraocular lens. Right eye is performed.
Okay, performed.
That is all
Sir,
in
for lens.
right?
So, we no need to code for lens again.
When you read the code description 66984, it's already included lens or not? Can you read the description? If it is included, no need to code.
Okay.
Next question number.
25.
25. What is your answer?
66985.
D, sir.
66985. Everyone?
D.
66984.
66984. Can you read the code description 66984?
Extracapsular cataract removal.
Okay.
Extracapsular cataract removal
with insertion of intraocular lens prosthesis, one-stage procedure, manual or mechanical technique, without endoscopic.
Now 985.
with endoscopic cytophotocoagulation. 985. Insertion of intraocular lens prosthesis not associated with concurrent cataract removal.
Now you can read the code description. They have removed any cataract here. Only are they placing the lens. What is done by what is the scenario done here? They are placing only lens, or they are doing
They implant a lens.
implanting the lens. Okay. Then what is your answer? 985. Yes, sir.
Yes.
Okay. Next question number.
29.
29.
29. Otitis media ventilating tube. General anesthesia.
No.
D is the answer.
35.
35.
That is D1 answer. So already we did.
Okay. Next question.
35, sir.
35.
35.
Conductive sensor hearing medical therapies. Yeah, what is your answer? Patient is consented.
C.
C.
Everyone?
C, sir.
Any other answers? Any other answers? Okay, next question.
37.
That's it.
37, sir.
40.
37 and 38. 37, 38.
37 and 38. Now, blepharoptosis of left upper eyelid, all are even modifier only. Aponeurosis, dissection. Yeah, what is your answer?
A.
Any other? You didn't. I need to explain this. Go for.
Sir, why not option C?
Okay. Go for 67901 then. 67901.
Yeah, sir.
Okay, can you read the code description?
Repair of blepharoptosis, frontalis muscle technique with suture or other material.
67904.
Tarsolevator resection or advancement, external approach.
903.
Tarsolevator resection or advancement, internal approach.
Can you see the fourth line in the question? The skin was excised to the levator aponeurosis. Lower strip.
Okay.
Superior tissue intact. Moderate elevation of the eyelid.
Okay, sir.
67901, right? That one you are talking about.
Yeah.
Repair of blepharoptosis, frontalis muscle technique with suture, banked fascia. Tarsal levator resection is going on. Yes or no? External approach.
Okay.
You can see excise levator aponeurosis, attenuated area, lower strip, excision, the lower edge excision of left upper eyelid. This all comes under 67904 or not? Internal approach,
Okay.
external approach. What is going on? 903 or 904? In that one will be your answer.
It's 903. I got 903.
Okay. You can see here what is
Approach.
internal approach or external approach?
External approach.
External approach. The skin marking pencil was used to outline the external proposed skin incision. is clearly in the second line. Yes, sir.
Attachment attaching the attenuated tissue superiorly to intact tissue inferiorly.
Inferior means, but approach
So
is
I
what?
thought it.
Approach is what? External approach, right? 67904. A is the answer. Next question number.
38.
38.
38. What will be your answers?
A.
A, sir.
A. Any other answers? Any other answers? Any other answers?
Sir, can you please explain 36 questions, sir?
Question number
36.
36. 36, right?
Yes, sir.
26-year-old female with 1 year history of left tympanic membrane perforation has consented to have it repaired. A post-auricular incision was made, dissection was carried out temporalis. The tympanic membrane was excised using a high-speed drill. A canaloplasty was performed until wood could be seen. The oscular chain was examined. It was found to be freely movable. The previously harvested skin was trimmed and placed. Slight elevating temporal fascia. Nothing is done here. Oscular chain is also good. Only tympanic membrane repair is performed. Now read the code description 69631. Read the code description 69631.
Tympanoplasty without mastoidectomy, initial or revision without oscular chain reconstruction, sir.
Without mastoidectomy, this is right. 696.
Yes, sir.
Okay. Next 69632. With oscular chain
With
reconstruction.
oscular chain reconstruction.
Ruled out that option. Why? Because there is nothing performed here. Next 69636.
Tympanoplasty with androtomy or mastoidotomy, middle ear. Sorry, sir. Without oscular chain reconstruction.
Okay. Now I understood. Now in the scenario, is there any mastoidotomy is performed?
No, sir.
No. Then B is the answer. 69631.
Okay, sir.
Hello, sir.
Yes.
Sir,
Yes.
sir, in question 19, option B and I don't understand difference in option B and option C, sir.
Question number?
Question number 19. 19, sir.
Option B and D, you didn't understand the difference.
Yes, sir.
Can you read the code description?
Uh, 67916, repair of entropian excision transal with
67916, entropian repair. Yes or no?
6791. Yes, sir.
Okay, but if you see the question, ectropian repair is performed.
Yes, sir.
Then blindly rule out option B.
Ectropian.
Understood what I
How, sir? I don't understand.
see in the question 19. What is the question? First of all, you can read ectropian or entropian.
Entropian, sir.
Ectropian, yes or no?
Entropian of lower eyelid.
19th question. You are talking about 19, right?
Yes, sir.
Read the question.
Yes, sir.
Ectropian.
Yes.
Ectropian, not entropian. Ectropian. 65-year-old patient
Yes, sir.
presents with ectropion of
Ectropion.
the right lower eyelid. Yes or no? Now, if you read the
Ectropion
code
of
description
Yes, sir.
916, what is the description? 916. 67916
Repair of ectropion.
ectropion
91. Sorry, sir. 91.
916. Option B, you are
916,
asking
sir.
about option B and option
Ectropion
A.
of excision. Excision. And sir, also 9023 is also excision, sir.
See, always look after the options. Don't go by the codes in the book. Only focus on the options what is given for you. A, B, C, D. In A, B, C, D, only you will get the answer. Yes or no?
Yes, sir.
Okay. Now that what I am saying, 67914, you are asking about the difference between B and D option, right?
Yes, sir.
Okay. Now 67914 read the code descriptions. 914 says about
Ectropion.
ectropion. 916.
Repair of ectropion.
916.
91.
Ectropion.
And transylvate.
916 ectropion. 923 is entropion.
Now blindly rule out option D. Why? Because ectropion is the procedure performed. Then B is the answer. One is
Yes, sir.
entropion, one is
Thank you, sir.
ectropion. Here the procedure performed is ectropion. Understood?
Yes, sir.
Any questions left in this paper that I need to discuss? The given questions yesterday?
Sir, 21. Sir, once come to 21,
Yes.
the answer is A, right?
Yes.
Sir, here my doubt is 66984 and 66982. This same procedure is performed in. Same
6698
procedure is
is
performed.
nothing but yes. The difference yesterday I said if the devices they are using, then use 982 iris expansion device like that.
Okay, here in this question, no device is using. So
That's
by
why A
default,
is
we
the
have to
answer.
code
A is the
66984.
984.
Okay.
The difference in those
Okay.
two code descriptions is one is using complex technique, that is devices. Another one is simple technique like that. Yes.
Okay.
Any questions left in this paper? Any questions left in this paper? No? Okay. Next, make heading digestive system. Yesterday we started or we need to start today? It's already started. Digestive system.
Yes,
Sir,
sir.
it's already started.
What I said, the differences between open, endoscopy and laparoscopy. Yes or no?
Yes, sir.
Yeah, done, sir.
Okay. Now make heading then. Endoscopy related rules. Endoscopy related rules. Endoscopy related rules. First one. Always see the scenario. Type of scope. Type of scope. Type of scope. What type of scope we need to see for when we are doing endoscopy? Rigid or flexible? Type of scope is rigid or flexible. Next one. Route of administration. Route of administration. What we need to look for here? Natural or artificial? Bracket stoma. Natural or artificial in bracket stoma. Third one, procedure performed. After saying that one, next you need to identify the procedure name. Procedure performed. Procedure performed. Next point. Is it a diagnostic or therapeutic procedure? 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 Next point. Diagnostic is a part of therapeutic. Diagnostic is a part of therapeutic. Code only therapeutic procedure codes. Code only therapeutic procedure codes. Diagnostic is a part of therapeutic. Code only therapeutic procedure codes. Now everyone see the screen. See, you can see I am drawing large intestine. Now you can see. Patient came here for lower abdominal pain. Physician passed a scope through anus, reaches to rectum, sigmoid colon, descending colon, then transverse colon, then ascending colon. He examined the large intestine. He found there is some polyps, overgrowth of a tissue in the transverse colon. He examined the total large intestine and he found there is a polyp in the transverse colon. But he is not doing anything regarding that polyp. He is retrieving the scope back. Can I say it as a diagnostic? Can I say it as a diagnostic? Physician passed a scope.
Yes.
Physician passed a scope. Understood? Then passed it through anus, rectum, then sigmoid colon, descending colon, transverse colon. He examined the large intestine. He found the abnormality, but the physician is not doing any treatment at that abnormality site. Can we call it as diagnostic?
Yes, sir.
Yes, sir.
For example, if physician during the examination he found the abnormality and he treated the abnormality, then it is a therapeutic. Diagnostic is a part of therapeutic. Understood everyone? Only examination of a body part without any treatment, we call it as diagnostic. During the examination, if the physician found and provided the treatment, then we can say it as therapeutic. See, first, what we need to find out? Type of scope. Next, what we need to find out? Route of approach. Third, procedure name. Fourth one, diagnostic procedure or therapeutic procedure. If therapeutic procedure, make heading colonoscopy, 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 sigmoidoscopy, colonoscopy, sigmoidoscopy, proctosigmoidoscopy. Colonoscopy, sigmoidoscopy, proctosigmoidoscopy. You draw the structure of large intestine again, everyone, to understand this concept. See, what is this colon? Ascending colon. This one, transverse colon.
Transverse colon.
This one,
Transverse.
descending colon.
Descending.
Here you can say sigmoid colon, rectum, anus.
Rectum, anus.
Okay. Now you can see if physician passed a catheter, that means scope through anus, rectum and reaches to sigmoid colon. Where is the end point of the catheter? Where is the end point of the catheter? Only reach to sigmoid. Then this is proctosigmoidoscopy. The end tip of the catheter is in sigmoid colon. We call it as proctosigmoidoscopy.
So can you repeat once?
If physician passed a scope through anus, rectum and reached to sigmoid colon and he retrieved the scope back, then what is the procedure performed? Proctosigmoidoscopy. End tip of the catheter is in sigmoid colon. Is in sigmoid colon. You can see here the diagrammatic represent. Where is the end tip of the catheter? Reached to sigmoid colon. Proctosigmoidoscopy. If the scope reached to descending colon and behind the splenic flexure, sigmoidoscopy. Behind the splenic flexure, sigmoidoscopy. Behind the splenic flexure, what we call it as sigmoidoscopy. Behind the splenic flexure, what we call it as sigmoidoscopy. After the splenic flexure, then colonoscopy. If the scope passes the splenic flexure, what we call it as colonoscopy. Now, can you tell me if the end tip of the catheter is in transverse colon, what type of scope it is? The scope is in transverse colonoscopy. If the scope is behind the splenic flexure, what type of scope it is?
Sigmoidoscopy.
If the scope remains in sigmoid colon, sigmoidoscopy. Understood, everyone? See, when the scope passes through anus, rectum and reaches to sigmoid colon, and from there if they're retrieving back, you can say it as proctosigmoidoscopy. From there it is moving towards the descending colon, then sigmoidoscopy. If it crosses the splenic flexure, then it is colonoscopy. Understood? Now, first we need to understand the type of scope, then route of approach. Third one is procedure performed. Fourth one is it a diagnostic or therapeutic? Diagnostic means only examination of a body part. Therapeutic means during the examination if they performed any treatment, code only therapeutic. Do not code diagnostic and therapeutic together. Understood the rules? Just check everyone. Check everyone the rules. See question number 31. 31. 31. Try to do that question. First read the rules and then do the question. See, what is the scope? What is the procedure name here in this question?
Sigmoidoscopy.
Sigmoidoscopy.
Okay. Diagnostic or therapeutic? What is performed by the physician here? Only examination or any procedure?
Diagnostic, sir.
Diagnostics.
Diagnostic. Only examination or
These therapeutics are biologists are applied.
therapeutic is performed? Then code only therapeutic. Then what is your answer?
45331.
Understood, everyone? Any questions
Yes.
here? See, sigmoidoscopy. Only examined a body part? No, he performed some treatment. What they have removed? Biopsies they have removed. Code only biopsy. 45331. Understood, everyone, the concept? See, Anu, that echo pacemaker ICD that we will discuss in cardiovascular during the surgery sessions. Okay.
Fine.
Question number 30, is that clear, everyone? Okay, do one more question. Question number 34. 34. Everyone, send me your options so that I can see. If you do any mistake, then I will again explain to you. When you are doing, then only I came to know whether you are doing in a correct way or not. Please do, everyone. Question number 34. In 34th question, what is the name of the procedure performed?
Proctosigmoidoscopy.
Proctosigmoidoscopy.
Proctosigmoidoscopy. Yes, sir, no?
Yes, sir.
No,
Yes, sir.
by using the proctosigmoidoscopy, he performed a diagnostic examination or he performed some treatment?
Treatment.
Some treatment.
Treatment. Okay.
Sir, 45315.
4-5.
45315.
315.
Everyone in the class. Everyone in the class?
Yes, sir.
Any doubts? Okay, this is the way we need to do. Now, just listen one more concept here in Scopies. In Scopies only, we can see, you can take this as the esophagus, stomach and duodenum. Okay. Now, if the catheter reached to esophagus and they retrieved the scope back, what type of procedure they performed? Only they examined the esophagus and they retrieve the scope back. What is the procedure performed?
Esophagoscopy, sir.
Esophagoscopy.
Understood. Where is the vent tip of the catheter? Esophagus. Esophagoscopy. Then if the catheter moved into stomach and reaches to duodenum, what is the scope name?
Esophagogastroduodenoscopy.
Esophagogastroduodenoscopy. Understood? Now listen the scenario. Physician passed a scope through esophagus, stomach and duodenum. He found abnormality in esophagus. That abnormality the physician is removing from esophagus. Now option A. Do you code from esophagoscopy or EGD? Understood my question? I can say again, I am repeating. Physician passed a scope through esophagus, reached to stomach and duodenum. During his examination, he found abnormality in esophagus. Physician is providing treatment at esophagus. Do you code it from EGD or esophagus?
EGD, sir.
First, always you need to understand the type of procedure performed. Here, where is the end tip of the catheter? In duodenum. That means in EGD is the procedure performed.
EGD.
In EGD, he is performing treatment. Understood? Don't code it as if the treatment is performed in esophagus as esophagoscopy. EGD. Now just make heading. Make heading, everyone. Esophagoscopy. Next concept. Esophagoscopy, EGD and ERCP. Esophagoscopy, EGD and ERCP. Esophagoscopy, EGD and ERCP. EGD and ERCP. ERCP. Now, EGD, other name is upper GI endoscopy. For EGD, other name is upper GI endoscopy. For EGD, other name is upper GI endoscopy. Upper GI endoscopy. Now go for the quotes. Now go with the page number 344. 344. 344. Go with the code 43235. Above paragraph is there, you just mark it. Above the code 43235, you can see the paragraph. 43235, you can see the paragraph.
Yes, sir.
You just mark that paragraph. If physician is examined only esophagus and stomach, you can say it as esophagogastroscopy. We can use 52 modifier. If repeatedly he is trying but unable to reach to duodenum, then we can use 53 modifier. Underline that paragraph. Guideline based question they may ask. to report esophagogastroscopy where the duodenum is deliberately not examined. What is the modifier you will use? 52.
Once again, can you explain, sir?
See, EGD means up to which part we need to examine duodenum. Yes or no?
Yes, sir.
But the physician deliberately, that means he wantedly not examining the duodenum. He examined only up to stomach. He thought that no need to examine the duodenum. Then it is esophagogastroscopy. What is the modifier they're asking us to quote? 52. If physician wants to examine the duodenum, but I am unable to reach to duodenum, then this is a discontinued procedure. What is the modifier I can use? 53 modifier. Understood?
Okay, sir.
So initially you thought, Kalpana, you want to reach to some other location. Okay. In between you thought that no need to go for that location, you came back. 52. You have reduced your distance. You want to reach there but unable to reach to the destination. You are trying to reach but unable to reach to the destination. Then discontinue. 53 modifier.
Yes, sir.
Okay. That is the paragraph. Now try to see the code. And one more point you just mark there. In ERCP also, go with the codes. See the code 43260. 43260. 43260. Above there is a paragraph you can see. If imaging of the ductal system is performed, underline that paragraph. We need to put imaging guidance separately along with these codes. 43260. 43260. Above there is a small paragraph. Are you able to notice, everyone? 43260. If imaging of the ductal system is performed, page number 348. 348. You can see 43260. Above small paragraph is there.
Yes, sir.
If imaging
Yes, sir, it is there.
the system, that paragraph you can underline. Okay, now I can see this. Question number 41. 41. 41. 41. What is your answer?
43244.
B, sir.
43235.
Understood now how to do endoscopy related questions? First, you need to identify the type of scope. If not there, then you need to see the route of approach. If it is not there, it is natural. Then procedure name you can identify. Then it's a diagnostic or therapeutic. That means only examination or any treatment. If they are providing treatment, code for each treatment. These are the 5 to 6 points that always keep in mind when you are doing any type of endoscopy procedures. Is that clear, everyone? Understood? Understood, everyone? Okay. Next, yeah, 43244 is the answer. Next, make heading hernia repair. Next concept, hernia repair. Hernia repair. HERNIA. Hernia repair. Hernia repair. Right? Hernia means prolapsing. Hernia means prolapsing or drooping of an organ. Prolapsing or drooping of an organ. Hernia means prolapsing or drooping of an organ. Now write down. What are the points we need to look for? First one, name of the hernia. Name of the hernia. Name of the hernia. That is based on the location. Name of the hernia. That is based on the location. Based on the location. Name of the hernia. That is based on the location. Example, incisional, ventral, etc. Next one, type of repair performed or type of procedure performed. After identifying the hernia name, next you need to look for type of procedure performed. Type of procedure performed. In the first one, laparoscopic. Second one, open. First one, laparoscopy. Second one, open. First one, laparoscopy. Second one, open. First one, laparoscopy. Second one, open. Next one. Is it initial or recurrent? Hernia is initial or recurrent? Initial or recurrent? Next one, age of a patient. Age of a patient. Next one, next point. Clinical presentation of hernia. Clinical presentation of hernia. Clinical presentation of hernia. That means clinical presentation of hernia. That means incarcerated, strangulated, incarcerated, strangulated, etc. Next point. For laparoscopic hernia repairs, mesh, MESH, mesh is included. For laparoscopic hernia repairs, mesh is included. For laparoscopic hernia repairs, mesh is included. Next point. For open type of hernia repairs, mesh can be coded for open type of hernia repairs. Mesh can be coded only for two hernias. Mesh can be coded only for two hernias. First one, incisional hernia. Second one, ventral hernia. Incisional hernia. Second one, ventral hernia. See what we need to look for when we are coding hernia. We just check everyone. First we need to identify the name of the hernia. Then what is the procedure performed? How many ways they can treat the hernia? One is open method, another one is laparoscopic method. Third one, that hernia is initial or recurrent. Then you can see the age of a patient. Then how the hernia looks like. That means clinical presentation. Then if it is laparoscopic hernia, we don't need not to code mesh separately. For open type of hernia repair, only for two hernias we need to code mesh separately. What are those two hernias? Incisional and ventral hernia. You can see the rules. These are the rules we need to follow when we are coding hernia repair. Can anyone repeat the rules? First, what we need to look for?
Age of a patient.
First, what we need to look for when you are doing a hernia related question?
Name of the hernia that is based on location, incisional, ventral, inguinal, umbilical, etc.
Inguinal, umbilical, like that. We need to see the location. Next one.
Type of procedure performed.
That means how many ways a hernia can be treated? How many ways a hernia can be treated?
Laparoscopically
And open.
Laparoscopically and open method.
Okay. Then after that, what you need to search in the question?
It is initial or recurrent.
That means coming for the first time or repeatedly. If they didn't document, then it is initial only. Next.
Age of the patient.
Age of a patient. Next.
Clinical presentation of hernia, that means
how it looks.
Incarcerated and
strangulated, reducible,
strangulated,
etc. Next.
For laparoscopy hernia repair mesh is included.
No need to code for any
type. For open type of hernia.
Okay. For open type of hernia, for two hernias we need to code mesh separately.
Repair mesh can be used only for two hernias, incisional hernia and ventral hernia.
Now try to see the question.
If it is inguinal hernia, we don't need to code for a mesh, sir.
No, for open type of hernia, only for two types of hernias we need to code mesh separately. What are those two types? One is incisional, next one is ventral. Remaining all other hernias, it may be open or laparoscopy included. For laparoscopy, by default it is included. See question number 35. 35. See the rules and then question. Question number 35. You can text me the answers. Everyone understood what are the points we need to look for? Are you coding? Tulasi 49561, can you read the code description? Tulasi, can you read 49561?
495 encapsulated and or fragulated.
Okay, that's it. Like that only we need to read. Read the code description completely. 561. Little bit loudly. 49561, can you read the code description? Sampath, can you read the code description 49561?
Yeah, okay, sir. Repair initially,
Okay.
yeah, incisional or
Okay.
rectal hernia,
Okay.
reversible,
Okay.
and increated or strangulated.
In case, but if you read the question, it is initial or recurrent, what they have documented?
In question,
Initial.
Question initial or recurrent?
Recurrent, sir.
Recurrent, sir.
Question is recurrent.
Recurrent. But if you see the code description 561, is it initial or recurrent? What is there in the code description?
Initial.
Initial.
Then
Initial,
it's
sir.
not an answer, Sampath. You coded as B. See, follow the steps what I said.
Yeah.
First, name of the hernia. Second, type of procedure performed. Third, initial or recurrent. Fourth, age. Fifth point, a clinical presentation. Sixth point, regarding mesh information. If you keep in mind these 6 points, you will code accurately. C is the correct answer. Understood everyone the concept? Understood everyone?
Okay, sir. Good.
Next one, make heading. Adenoidectomy and tonsillectomy. Next question, next concept, adenoidectomy and tonsillectomy. As you know, where tonsils are located in a human body? Where tonsils are located in a human body?
Throat.
Throat. Oropharynx. Where it is? Oropharynx.
Oropharynx.
Next, adenoids, nasopharynx. Write down.
Nasopharynx.
First point, age. What we need to look for when you are getting a question, adenoidectomy or tonsillectomy, first key term is age. Age. Second key term is primary means initial. Primary means initial. Secondary means subsequent. These are the 3 key terms we need to look for. Primary means initial, secondary means subsequent. Now see question number 12. Question number 12, 1, 2. Question number 12.
నన్ను చేయలేదు ఫస్ట్ వచ్చి నేను అందులో వేసి పెట్టు
Completed everyone? What is the answer?
4283.
42836. Yes or no?
6.
Age is 12 years. He
Yes,
is
sir.
performing
Sir.
appendectomy for the second time. That means secondary. That's it. These are the concepts in digestive system. Understood everyone? See, in digestive system, you need to look for if a procedure is performing 3 points, always keep in mind. They performed it through endoscopically, laparoscopically, open. Understood? This is all about digestive system. Take the questions for practice. Question numbers 7, 20, 20, 20, 36, 7, 20, 36, 39, 39, 39, 43, 43. How many questions total?
5.
5. 49 and 50. 49 and 50. These 7 questions you can practice. Understood everyone? Digestive system. If you understood anatomy, terminology, and these are the basic points that we can code any question from digestive system. Okay. I completed 60,000 and 40,000 series for you. Then 4 sections are remaining in surgery and HCPCs. 1 more week the syllabus will take. That means by January 23, we will complete the course for your batch. After that, you need to practice. Any questions? Any questions?
More related to anastomosis and gastrostomy and enterostomy, or anastomosis is
Direct
done
questions.
then.
If you understand the terminology, you can do it. For example, enterostomy means what? Entero means small intestine. Ostomy means artificial hole creation. Gastrostomy, the same procedure. For example, you can take this is a tube. Okay, small hole on the tube. What we will do? We will cut at the both ends of the tube. Again, we will join. That is anastomosis. Joining the two ends is nothing but anastomosis.
Yes.
Sir, in laparoscopy key terms, percutaneous endoscopy on abdomen is there. So, do we need to look for endoscopy or laparoscopy? If they give a question like percutaneous endoscopy, generally we will go for endoscopy, no sir?
Percutaneous endoscopy means you are going as endoscope. Abdomen. I clearly mentioned the body part as abdomen.
Yes, sir.
On abdomen, Kalpana. I clearly mentioned the body part as abdomen. See, you can see here
sir.
how they will perform this technique is. You can say this is a stomach. You can see the diagrammatic representation. You can see this is a stomach. Okay. This is, you can say, umbilical portion. They want to enter into the abdomen. Yes or no? This is, you can say, an abdomen. Middle portion of the abdomen, you can say it as umbilical portion. They want to examine the abdominal organs. How they will enter into the abdomen? Is there any opening on abdomen? Kalpana, is there any opening on abdomen?
No, sir.
No. They need to pass through the skin. Yes or no? Percutaneously.
Yes, sir.
Okay. Now for that, what they will do is they will place ports. Port. This is one port. You can see tube-like structure. This is one port. Nowadays 3 ports are placing maximum. This is one port and this is one port. Understood now, Kalpana? Through this port, they will pass the catheter. That means scope. And they will examine the body parts. And through another port, they will remove the organs like that. These are the ports. Like cylindrical structures. Cylindrical structures, you can see this is a cylinder. In chemistry labs, we will monitor cylinders to pour water.
Yes,
like that, you can say, you can consider it as port here. Placed on the abdomen. Through the port, they will pass the catheter. That's why I said percutaneous endoscopy on abdomen.
On abdomen. Okay, sir.
The body part is abdomen. If I said percutaneous endoscopy on joint, then it will become again arthroscopy.
Yes, sir. Thank you, sir.
Any other questions? Anyone? See, as you know, tomorrow there is no class for you all. Up to Sunday. Please practice those questions. Wish I complete in the completed topics. Okay. So I'm going out of station. Understood, everyone?
Yes.
I informed you already. There is no class for you. Just you are having a lot of questions. I completed nervous system paper. You are having those questions. Then digestive questions. Then digestive questions. Then E&M, anesthesia, all those questions. Okay.
So on Monday only class will be there, no?
Yes.
Okay. Happy Pongal.
Thank you, everyone. Same to you all.
Thank you.